right, welcome and good evening, viewers. This is Health Up Show. We are glad that you're joining us today for this particular program, and we believe that this is going to be of help and of importance to all of us. Yes, my name is Onesmus Mogo. I'm a clinician, also trained in areas of public health, currently in private practice with the Open Medical Center, which is along Garissa Road in Thika, and we are glad that you're joining us. Karibuni sana. On our show tonight, we have our guest, Eunice Macharia. Eunice is a reproductive health specialist who is also on practice, and we are glad that you joined us and found time for us this particular evening as we discuss matters reproductive health. Karibu sana.
Thank you.
Maybe you can say a word as, probably you add more the introduction if that's necessary.
Okay, thank you so much. And thanks for having me again. Yeah, as you said, my name is Eunice Macharia, a clinician with a specialty in reproductive health. And I'm glad to be here to discuss matters of reproductive health.
All right.
Yes.
Right. Of viewers, tonight we're going to be looking at matters menstrual health and look at the diverse ways, and this is going to be probably some of the problems or some of the abnormalities that occur alongside with it. We've done a previous show that looked at some of the normal aspects and the normal concepts regarding the same. But today we're going to just get a bit deeper and look at what some of the problems are associated with it. So if you're joining us, for the first time, Health Up is all about wellness, empowering our health, and our objective is that we may bring a lot of public, health awareness, education, and be able to encourage all of us to lead a healthy life. Remember, a healthy life is a healthy nation, and we can't be able to improve our economy, even saying so, without healthy lives and healthy people. So we are glad that you're able to join us. Down there are numbers that are going to be, going on, or just, coming and going. You can interact with us. You can probably send an SMS. You can use it to send a question or a comment about what is happening here, and we believe that's going to be okay and fine with you. We also available on social media platform. You can, access us also through YouTube and Facebook Live, and you can also invite friends and share, and let's benefit each other in this time. Remember that Health Up is also a program that is open, and that is really good for all family members. It's a program you can watch with your family, you can watch with your spouse, you can watch with your children. It is open and it is of great importance, and we believe that you're going to be blessed and you're going to be empowered even this particular evening. Karibuni sana. So we're going to be looking at matters, abnormal bleeding problems and abnormal issues that to do with menstrual hygiene, menstrual health, sorry. But it's of importance. I know we have talked about this previously, earlier on, but it's of importance for probably viewers also to understand. We always move from known to unknown,
Yes.
and build up a concept after another. Even in the Holy Scriptures, the Bible says that we know a precept after another. We build from one level to the other. So probably we would want to build up and be able to see what is this that you're talking about, say menstruation, say menstrual health, these issues. What do we exactly mean, and what are the basics, what are the normal about it? Yes.
Yes, okay. Thank you so much. And as you have mentioned, when you talk about abnormal issues of menstruation,
Yes.
we need to look at the normal.
Yes.
And having had a previous understanding,
Yes.
what I would say is we know menstruation starts at puberty,
Yes.
and after that, it's expected that every woman or young girl will have their cycle, which we said a normal cycle, or as it is, that a normal cycle is between 21 days to 35 days,
Exactly.
and it differs with individual. And what would be very important for me to mention, because most of the women, when they come to us, we always ask them, what is your cycle?
Exactly.
And they don't know. Some will tell you, my periods come on 16th. Every 16th
Every 16th of the month.
of the month.
Yes.
If it doesn't come 16th, 17th,
Thereabouts.
there are some who may have such a close pattern.
Yes.
If at all they are having 30 days,
Yeah.
that may vary just a day.
Okay.
But for majority, it is not likely because the months don't have the same days.
The same days. Yes.
And what we may want is not, it has this. So I would encourage our viewers, our young women and other women,
Yes.
to understand your cycle, and the cycle is from the first day of your menstruation, not when they end. The day they start.
The day they start.
The day they start.
Okay.
Is your first day of the next cycle.
All right. Okay.
So that if it starts on 17th, then 17th is the first day of the next cycle. Then you count until when they end. I mean, when the next one starts. So if they start on a 16th, that means your cycle ended on 15th.
On 15th.
So you're going to count from 17th to 16th to 15th.
Okay.
And you see how many days are there.
How many days are there?
Yes. If you do 3 to 6 months, then you're likely to find what is your normal cycle.
So you are saying that's very important because many times when you talk about the last menstrual period, you know, what comes into the mind is, you know, the last day.
The last day, yes.
You know, of that particular cycle. Sometimes you also have misconceptions, you know, it's from, like you say, if 16th of this month to the other, you know, we'll basically be looking at, you know, 16th of the other month.
Yes.
But you're saying the first day of the last, you know, menstrual period. That is a very important date that we need to mark.
Yes.
And that is the day that we use to be able to count, you know, what is the cycle of this particular person. Okay.
Yes.
All right.
So there are some who are going to find I have 21 days. After every 24 days, my periods come. The others who may have a regular, irregular.
A regular,
irregular.
Okay.
Like you find there are times it comes after 21 days, and there's a cycle it comes after 28 days. But you have to maintain those two patterns.
Okay.
So you need to know you are normal.
So you have some irregularity which is regular.
Yes, some irregularities that is regular because it is not all 21, it's not all 28, but it ranges between 28 and 21. That's just for an example.
That's just an example.
Yes.
Absolutely.
And if yours don't have a consistent pattern in terms of days,
yes,
the variation of one day may be counted by hours.
Okay.
Maybe it had come in the evening, then it come again in the morning. So it could still be the same days.
It's the same day.
So that should not worry you.
Okay.
But if you find there is quite a number of days that brings a difference, then you could still be within your number, but your periods are irregular.
Irregular.
Yes.
All right.
Yes.
So we are talking, that's about the cycle.
The cycle, yes.
What about the flow?
The flow? The flow, the normal flow,
yes,
we count in terms of days.
Yes.
And it should be about 3
yes,
to 7 days.
yes.
Many people will be between 3 to 5 days. 7 days is still within the normal range. Yes.
Okay.
So someone need to know their normal again, because if you have 3 days and you start having a 7 days, what has brought a difference?
Exactly.
So someone will come and they have 7 days and it is normal. Another one will come and they're seeing it for 7 days, and we are going to investigate because we will wonder what is accounting for this 7 days.
For these 7 days.
Yes.
What about the difference? Could be the factors? I mean, I'm just saying that you will need to account for what could be the factors.
What could be the
yes, that basically causing that this flow is changing from
we can
from 3, 5,
investigate
7
and all
days.
that.
We can investigate.
Yes.
And all that. And
then again,
yes, please.
The amount.
Yes, please.
Yes. In books we talk about 80 ml.
8 ml.
8 ml. But again, we use pads.
We use pads. Maybe that's
so you cannot measure the 80 ml.
Is able to relate
between
with
30 and 80 ml. Actually, between 30 and 100, because if it goes beyond 100, that's the time we would consider it a lot. But because we are not measuring, someone need to understand their normal number of pads.
Yes.
So if you have been using 3 pads, and some people will have it heavy on one day, and others will have it heavy in the 3 days.
Okay.
So you need to understand your normal.
You need to understand.
So that when you start getting a diversion of your normal, then you're able to pick it. So if you have been seeing it and you have been using 3 pads every day, then you start using 4.
All right.
You start using 5 that are fully soaked.
Fully soaked, not just the one
that tells you your amount is getting bigger
than normal. Than what is usually the experience.
Yes, for you.
All right.
Yes.
So the number of pads is important in a day, because you're also going to use that to be able to tell, is now this an abnormality or is it a variant within the normal, or that which is acceptable.
Yes.
Viewer, I believe that this is beneficial to all of us. Kindly, you can send us an SMS, interact with the number that is going down there. Join us on Facebook Live, Elevate TV. We're also on YouTube, and probably you can also check on us on our website. That's also live, and the program is also live on that. Thank you so much for joining us. Now, Madam Eunice, we are saying that the issues, we need to understand the normal. We looked at the menstrual cycle. What is the normal? we have looked at the flow and also the amount. Before we get into, what are some of these abnormalities? Are there anything that you want to mention within the normal things so that people to see what is going to be abnormal? Anything normal?
The other normal that I would mention is
Yes,
that there are some people who experience some symptoms that are associated within their cycle, what you call premenstrual syndrome.
Yes.
And it also has mild, moderate, and severe form. So when you understand what is happening to me, it is easier to handle, and it may not necessarily a sign of sickness. And what makes somebody know that what I'm experiencing is a premenstrual syndrome is it should occur in the second half of your menstruation.
Second half of your menstruation.
Yes, if something is happening, because those symptoms share symptoms with so many other diseases, including fatigue and stress.
Yes.
So, so if you find it's coming before the second half, don't assume it is premenstrual.
Premenstrual. It could be burnout from work.
It could be burnout.
It could be another disease,
other
another
illnesses,
problem, other issues, stress, these are factors that you're talking about. So we are saying this occurs. So, and that was the importance of you telling us, that the first half, and then you have the second half, and you have clearly, showed us on how even the dates and the days on how we count, so that now we can be able to say this is falling, in the place whereby we are expecting the PMS to be occurring.
Yes.
All right.
Yeah. Then again, there are other people who may also be experiencing pain.
Yes.
What is important, and especially when we think about someone who is not within their teenage, is that when did you start experiencing the pains within your menstruations? If it started coming after you started your periods, what we call menarche, or it has been coming, it can be after 2 years, sometimes not exactly immediately, but in your teenage, if that is the time you started experiencing the pains, then it may not be a sign of sickness. It may be a normal pattern for you.
A normal pattern
for you. Yes, that you experience the dysmenorrhea or the painful menstruations.
The cramping is basically that.
Yes. Yeah.
Thank you very much. I think that it's very important for us to understand what is normal, and so that now we can be able to move, to these abnormal patterns. Now, going to these abnormal patterns, because I think these are issues. We have already been able to see through various, studies here there, that these are not issues that are easily discussed, at home. That a girl is going to bring, just after the meals, after supper, and the discussion just begins. We also, seeing that some of these girls are getting this information or trying to get some support or some shoulder to lean on in that particular regard, even from other sexual, from sexual partners, and others, going for money and transactional sex and these kind of things. And therefore, it brings to us a point whereby it's very important for us to be able to understand what are these abnormal patterns, so that if there could be some of our viewers who experience some of these things, be able to know how to approach them, and that this is really abnormal, and we need to seek health advice, and that this needs to be done as soon as yesterday, so to say, so that we are able to save the situation. I think so imperative also to note as we go into that is that education awareness is still lacking. We still have a lot of information flying here and there that sometimes it's not authentic, sometimes it's not justifiable, it's something that you still need to measure in that sense and query to some extent. So we have information, yes, there is awareness, yes, but some of these things is not as it is supposed to be. So what are some of these abnormal patterns that you probably want our viewers to understand, and how we can be able to approach them?
Okay, thank you. One of the things that we have already mentioned in the normal. Then if you see that diversion from the normal, and that's why we are saying you need to understand your normal. Like for instance, you may have somebody who gets increased amount of menstruations.
Increased amount of
menstruations. Than what they were having before, and sometimes even a prolonged duration. Some may have it even for 10 days, and that was not, or even someone was having for 3 and have at 7, and that was not what was their normal. So when they start changing a bigger number of parts, what we call menorrhagia.
So you're saying there's an increase in the number of days, most of the times, or an increase in terms of the amount.
Yes. So when that happens again, it is a point of consultation. We need to find out why are you having these heavy menses, or why have your periods started increasing in amount. Just to mention some of the causes that are not limited to this.
Okay.
Yeah, because sometimes you may have somebody with uterine fibroids. The fibroids are tumors that are not cancerous, that comes into the uterus, and they grow over age, and they increase the volume, and they start causing somebody to have more heavy bleedings. Heavy bleedings.
Yes.
So sometimes many people will only come when it becomes too heavy. And some of them might even come, they're getting to a point where they're becoming anemic. They're losing a lot of blood until you get anemia. So if your amount starts increasing, and when you find it significant, it is important that you seek for health advice. Sometimes it can also increase because of the family planning method someone is using. So we need to be sure that it is not because of an illness, but it's because of, yeah.
We are basically saying that this is abnormal.
It's abnormal.
Heavy flow is abnormal.
Sick.
We need, this is a sickness. At this juncture, we are saying that this heavy flow is a sickness, and we need to investigate the cause. And you bring it very well, saying that actually some of these have bad effects into the body.
Yes.
Because you're saying someone might become anemic. Maybe that's one of the things that our viewers would want to understand, and it's important to bring it forward. When we say that heavy bleeding can cause anemia, what do you exactly mean? Because I think when we understand what are some of the effects, the way we say, what is the worst that can happen, with this particular situation.
Yes.
So sometimes when you're able to understand what are some of these worst effects, it becomes a trigger.
Yes.
So when you say it can actually cause anemia, there are two things there about anemia, and you have mentioned fibroids, but when you say it can cause anemia, what do you exactly mean? And why do we fear it going to that extent?
Definitely if someone is losing blood,
Yes.
because the blood someone is losing, it is part of their body blood. Okay, because that shedding of the endometrium, of the uterine wall, it is coming also with blood vessels that are in the body. So if someone loses a lot of amount, they are losing part of their body amount, blood.
Yes.
So eventually they are going to have low hemoglobin levels.
Yes.
And when you have anemia, if you want to know you have anemia, you start getting fatigue. You get easy fatigability.
Yes.
You can't,
Easily
when you're doing normal
tired,
activity, you start getting
yes,
tired.
yes.
You walk a distance, maybe you can walk well when you're on a flat area. You start climbing stairs that you are climbing before you cannot climb. So that means your blood level is coming too low. And of course, what happens when your blood level starts coming too low, you get other complications in the body because your heart has to pump more.
Has to pump more, has to pump faster.
Have to pump
because
faster.
The volume is minimal.
Yes. You even start hearing your heartbeat because your heart is acting more and all that.
You are more aware that your heart is acting.
Yes. So we wouldn't want to get there out of a physiological process. So when something starts changing, then we need to know. And someone should not just sit down and say, my periods are too heavy, I have to sleep after a few days, for a few days.
Right.
They need to be
checked. They need to consult. Our viewers, we're talking about menstrual health, and we're talking about abnormalities that do occur, in terms of this. We're saying this is a normal physiological process, but sometimes it gets off the cuff, and we need to intervene at some particular point. And we have a guest tonight, and we are at the point whereby we are saying heavy menstrual flow needs to be checked. And you just mentioned, Daktari, that heavy menstrual flow is going to cause several effects into the body. There are some also other causes about it which needs to be investigated.
Yes.
All right. Probably you can want to expound more on what are some of the other abnormalities that that do happen, because I believe these abnormalities probably are many, and they have they are dealt with case to case basis. Yes.
So like we have said, you can have a heavy bleeding.
Yes.
The opposite can also occur.
The opposite can also occur.
Yes.
So it can actually be minimal bleeding.
Minimal bleeding.
All right.
Maybe even spotting.
Okay.
So if again that happens, we need to find out why.
Okay.
Why are you having lesser amount of blood or of bleeding?
Yes.
Yes. And one of the things that we'd want to check out is family planning. I know most of the time when you're having a particular method of family planning,
yes,
it may affect your menstruation. That is important to mention.
Yes.
That most of family planning methods may affect, not for all, but for some
of
it
them
may affect their patterns.
Yes.
But again, when we establish and it's not going to the level of losing too much blood, then again, it's not causing much, then at least you need that reassurance that it is because of this.
It is because of this particular method that you actually use.
Yes. So when you have lesser amount, again, it also becomes a concern. The other thing that is very important is when you're having periods or when you have bleeding in between your cycle,
Okay.
what you call
Bleeding.
hemorrhagia.
Bleeding in between your cycle. Because we said there is a normal cycle.
Yes.
And there is no exemption. This is the normal that we expect for this particular lady,
Yes.
for them to follow. So if it's not following this particular pattern, there is a problem.
Yes.
So bleeding in between the cycle.
Yes.
Can you tell us more about this bleeding in between? We have used that terminology there,
Yes.
which is okay. Can you tell us more?
Yes, we call it intermenstrual bleeding.
Intermenstrual bleeding.
Yes.
Because it's in between years.
Yes. And we expect that's why I kept saying from the beginning, it's important that everybody understand their cycle.
Their cycle, yes.
Yes. So if you start getting either spotting all bleeding in between your periods, then that is not a normal cycle. And we are going to consider it as an abnormal bleeding.
As an abnormal bleeding.
Yes. So we still need to find out, why are you bleeding in between your menstruations?
Yes.
Yes.
Are there some, some factors that are within the, the person's reach, because our viewers probably asking ourselves, okay, some of these, the doctor would want to evaluate and know whether there is a problem within the reproductive organs, the uterus, the ovaries, or maybe other organs within the body, which would be causing this. Are there, other issues or other factors that could actually cause intermenstrual bleeding? Maybe that are within the patient's reach, maybe not, maybe yes. Yes.
Yeah, there are several factors that may cause intermenstrual bleeding or bleeding between the menses. And maybe just to mention a few, I'll keep going back to our family planning methods.
Yes.
Because I've said they commonly affect, and I always believe that we usually have counseled our client if they observe that. So that is the first thing that we'd want to understand, whether they're on any family planning method, and you see whether it's the same that is causing that effect. That effect.
Yes.
The other thing you worry about, because we have cancers of reproductive system. Okay.
Yes.
Yes. So you worry about that, and you want to find more. That's zile tunakuwa maswali mingi kama ya daktari.
Maswali mingi kama ya clinic,
maswali mingi kama ya clinic, Yes. But we ask so many questions, even in terms of somebody's sexuality. Yes. All that is geared to helping us make a diagnosis on why are you bleeding in between your menstruations.
Right.
Yes. So and like the choriocarcinoma, the cancer of the uterus, the cancer of the cervix, which we always encourage mothers to go for screening. So there are so many things that you worry about. Sometimes it may be just because of infections. Yeah, you can get infections within the reproductive system, and it can cause you to bleed in between your menstruations.
All right.
Yes. Wow. So going to the clinicians, being examined, and management is very important.
Right.
Yes.
This is health.
And don't assume somebody's pattern is yours.
All right. Yes. All right. I think we have much here, and this is great. This is Health Up, and we are happy, and we're joining you, that you're joining us tonight as we discuss these issues about menstrual health and some of the common abnormalities. So kindly please, if you want to interact with us, and that's very important and that's useful, use the number that is going down on the screen there. You can send us a text and your input there is going to be of much importance. Now, Daktari, there's something that you're talking about here, which is defined to be very crucial. You're saying, we are talking about these abnormalities, but you're saying there are other factors which could actually cause, like intermenstrual bleeding, just to pick that, for example.
Yes.
Now, what would you tell this particular client, that goes on to a hospital and they have this particular bleeding, and because I'm sure you have encountered this, these patients in your practice. They go into a clinic and they find, there's a gentleman, who is the caregiver, who is the doctor there, and the questions are a bit too personal. Because you mentioned somewhere, we want to hear about your sexual behavior, because there are other causes, that would go in line with that. So how would you reassure, or what information would you have for this particular client who goes to a hospital, finds a gentleman, either young or old, whichever the age, and they need to build a rapport, and these need to come out, but somehow for some reason they are not coming out, and there's some discomfort. The questions are a bit too personal. Maybe what advice would you give this particular client as we just delve into this?
Yeah, I can see you're defending your, your gender.
Yes, you know, we must, you know, there's much that has been talked about, you know, about the girl
Yes,
child,
yes,
the girl
yes,
child. What
yes.
about, you know, the big boy child, you know,
Yes,
in
yes.
that sense. So,
Yes,
you know,
yes.
and some of these, sorry to take a little bit of your time,
Yes.
is that you will ask, you know, hakuna daktari mwingine, you know, that's one says hakuna daktari mwingine. The next question probably they will also ask in Swahili, you know, hakuna daktari mwingine means, is there not any other doctor?
It's
The other question they would ask is, hakuna mtu mwingine mzima, you know, there is no adult who can actually say, because seemingly you look like a young man, a young, you know, not a boy anyway, but a young person.
Yes.
And they feel, you know, these are some personal things.
Yes,
Because
yes.
you're beginning to ask, you know, menstrual flow, beginning to ask about your last menstrual period, sexual behavior. What message you have for this? You know, to tell, you know, the boy child,
The boy child.
you know, for a minute or two.
Yeah, I think what our viewers, what will be very important for our viewers to understand
Yes.
is that your health comes first.
Yes.
Your health comes first.
Yes.
And we are all trained, as long as you're in the hands of a trained personnel, because again, they have also been trained
Yes.
on how to handle
Right.
all genders.
All genders.
Yes, because you have looked only on one side.
Yes.
But I know also there's also the other side of the story,
All right.
where you have a young man who has reproductive health issues, and then when they come and they find it's a female, they also shy. They won't say anything.
They say they have a headache.
They
you
start
know?
with a headache.
Right.
Then they go to the foot, and you're wondering, so the head and the foot, where are they meeting?
Oh, are they related?
Yes,
Are they related?
yes, where they are related.
Yes.
Yes, and we have also been trained on how to create rapport
All right.
and bring this person on board, which is usually very important. And I think many a times our clients only need reassurance
Yes.
that what we are discussing is in line with your illness, and what we are talking, it is the honoring of the privacy.
Yes.
That is very important. Yes, but our viewers, I would say that don't look in terms of gender. But I always say you respect. If a male feel they are not comfortable consulting a female,
Yes.
we always have our colleagues who are males.
Exactly.
If a female feel they are not comfortable consulting, then it is also good to allow them to have that choice.
All right.
And I can even invite you to come and see somebody in my clinic if they chose a male.
Absolutely. Absolutely.
Yes, because sometimes, but then the viewers don't discriminate.
Don't discriminate.
Yes, it is important, because what your health come first. The male, the female will help you. And of course, we're going to observe our protocols.
All right.
Our oath
Yes.
should be respected.
Should be respected.
Yes.
This is becoming really interesting, and a lot of input is coming forth. This is Health Up. Kindly don't touch that dial. Let it remain elevated. You're going on for a short break, and I'll be back. We'll continue about these, you know, abnormal uterine breeding patterns, and we're going to get much information. Thank you very much. Keep it elevated.